everybody. Good morning, Navajo Nation. Jonathan Nez here, Navajo Nation President. Yate, Kizikido, that Kinatido, the Isanotsagi, Shed, and Hitido, the Lia, Sabine Skrede, Ene Kredi, in Bado, Le, Lance, Silete, Slaughter, Linigi, which I host a lot, so which is a clean pinga. Kudo chata sensito o hien ha tabidi ni chukon hika nacha large shirts that linigi ota ha he tabidi ni do mesente nasho ota di krebi chini kana lendi kusits kagina states ata di nas nigi konde o he di nakijenana adi tao Sunday atamon atle di kosinskagina states at the con he can hinne nakhalchin randal nishigi bana nishide linigi banda huilne aro kondo ena tina kudo ni jashanen daily he master da lido hilla do khala wash betrada kis and sanitize which does aro hedan le harenda kaigi bisandatle hatene cho AI nan tinara hagan so tram ado latlashi ato nakhada selgi kecho padeni kena shumuna khada seti ze kijana nashki to kosantsagi ila nan khada nits patagon skeno lady. We welcome you to another town hall meeting, and I'm hoping that the audio is okay. Eli, if the audio is clear, or are you hearing the wind?
A little bit of both, sir. So we're okay.
All right, so we'll begin today's town hall meeting with an update. Yesterday we got our daily case count of 19 cases in 24 hours. So thank you everyone for doing a good job telling our family, our friends, our community to continue to wear our masks, social distance, wash our hands with soap and water. I know many of us carry around a hand sanitizer. Continue to do that. If you run out of hand sanitizers, let us know. Give us a call, 928-871-7000, and we'll let you get to a place nearby to pick up some hand sanitizers. And of course, stay home. Stay home as much as you can, and we'll get through this. Last year during this time, we saw a big uptick in cases, because we traveled during the Labor Day weekend. We went all over the place. We picked up the bug and we brought it back within our homes. Now, we don't want the same thing to happen. We just ask you to, just continue to wear your mask and be vigilant. Some of you may have traveled off the nation. Just stay away from the families that stayed here on the Navajo Nation for a few days. Maybe even go get tested just in case. You could be asymptomatic walking around, and we just don't want no big spread like we saw last year. We're going to be going into the holiday season again. It's going to come up pretty quick. November, December, January. Remember last year, that's when the spike happened where we beat a lot of records with COVID-19. And so we don't want that to happen this year. I know that many of us have gotten our vaccinations, which is pushing back on the virus. Thank you so much. Not everybody has gotten their vaccine, so we encourage those individuals to get vaccinated. So we're here in Monument Valley, beautiful Monument Valley. I was here today to meet with the Arizona sheriffs. There's 15 counties. Over 10 of the sheriffs are here on the Navajo Nation. They went for a horseback ride yesterday, of course, all following the protocols, working with the Monument Valley Tribal Park, the Parks and Recreation staff that are here doing an outstanding job at keeping everybody masked up. A lot of visitors coming into the Navajo Nation, 50% occupancy, right? Mask mandate happening. And so we're visiting the tribal park today to let everybody know that, we're all in this together and we are going to push back on COVID-19. So as I was mentioning, a lot of the reports that we're receiving from the healthcare facilities and the contact tracers, they're telling us that, much of the virus that is being spread here on the Navajo Nation are because of social gatherings and family gatherings. Uh, it's the same message, ladies and gentlemen. It's the same message that every week we bring to you the past for 18 months. And it's no secret how to push back on the virus. Uh, Mask wearing, taking care of your personal hygiene, no family gatherings, social gatherings, please, and staying home as much as you can. And of course, getting vaccinated. See, that's it. 5 things. And we appreciate the Navajo people for doing an outstanding job, uh, following these protocols, keeping our daily case counts low here on the Navajo Nation. As I was mentioning, we met with the sheriffs, Arizona sheriffs. We appreciate their support throughout this pandemic. Uh, we visited with Sheriff Deadman from Apache County, Sheriff Klaus from Navajo County, uh, Sheriff Driscoll from Coconino County. Those are the counties in Arizona that are on the Navajo Nation that have been helping us throughout this public health emergency. I also said thank you to them for assisting us during the monsoon emergency, if you want to call it that, or the rains that have come down lately that have washed out our roads. We need to get our officers, our CHRs to those high-risk patients. And so collaboratively, a partnership with our Chief of Police, Philip Francisco, and our Division Director, Jesse Delmar, keeping our Navajo people safe. So I said that on behalf of you all, the Navajo people, to the sheriffs at their association meeting today. That's why we're in Monument Valley. Every week we give you an update on what's happening with the COVID-19 public health emergency. 19 cases yesterday, which is low. No deaths, and we just continue to ask for your support and continue to do follow through on these protocols. Dr. Jill Jim is on the town hall today. Captain Johnson are on there as well to give you an update from the Navajo Nation. We got through a 3-day weekend, and I hope many of you had fun with your families, of course, your immediate families, having a meal together. And as we see a decline in cases, I think many people are starting to come back together as families and to have those events. But we want to have it done safely. That's the bottom line. So with that said, I'm going to say a quick prayer as we open it up, and I'm going to turn the time over to Dr. Jill Jim, who will give us an overview. So let's pray. Our Heavenly Father, we just come to you to stay here. Town hall lehigido ajo kodo na tien do ben del neshigi hanne tikeni nebich hashane del ne shidi gadio de na tagido na tiniki dich ashane in lagido in legi ba henitz aro anils ko nebiki apakado khalia shidi yote hikidni aro kondo so die enige nasa jedastel die enige nasa yitsa nda iste nda die niche nche edo son londo leftik edan linigi aro jebe de dilchisto kodo yahdal ni do les aro kodo ahead and he ido that on he can on which basically na ya kon ni the ke ka ni na ge ni the det the idiote. We continue to look up to you for strength, wisdom, protection, and good health. I pray for that for all of us on the Navajo Nation, for all of our Navajo people, for all of our partners, for all of our people. Five finger beings, Lord, let us be protective of ourselves and our family and our communities. Maybe we be able to uh, instill into those that may be uh, not following these protocols or maybe not wanting to get vaccinated. I know the decision is theirs, but we encourage them, God. And just because, even through many times in the Word of God, instructions are given to leaders. Leaders are put into these positions that you speak to them and that they instruct their people. This is no different. Leaders are telling our Navajo people to follow these protocols. And we just ask that they hear uh, leaders and to follow through on those things that they are encouraging our Navajo people to do. So we lift this time to you. We lift this town hall to you. Let the information flow to everyone, all our Navajo people, all our citizens. Kudo hane, yej tiegi hane, yikeni nebiche ashane de nagi. Edo Bais adole di nashdi yote. Ara e ben nache e da haliado. Kodo ba chin bikedan zenigis. Keda hat inigido. Khota hane. Iche konda yi dole akuiche. E ba heni tinshdi yote. We just thank you and praise you. We give you the praise and glory, what you're doing now and what you're going to do now. We just pray this all in the name of Jesus Christ. Amen. Amen. So that's the prayer. I gave you a little update of what's going on. And I think we have some park staff with us today. And they'll introduce themselves to talk about the protocols that are in place. And there's a lot of things that are being shared with our visitors here. So, we don't recognize each other, but here we got the manager, right? The manager for Monument Valley Tribal Park with us, and she will give us an update. Maybe just give us an update of how many visitors have come, 50% occupancy, although mask wearing protocols. I know some people call and say those people at Monument Valley are not wearing masks. You'll hear it today. We are telling people to wear masks here at the Monument Valley Tribal Park and all the tribal parks throughout the Navajo Nation. So come on over and introduce yourself, Alan, and give us an idea of what's going on here at the tribal park.
Good morning, everyone. My name is Adeline Sahani. I'm a park manager for Monument Valley Navajo Tribal Park. We do wear our masks every day here inside the park and even outside the park. And it is a 50% occupancy. We do have a limit inside the park where we have the tour operators, we have the people that been down in the valley, and then we have visitors that come inside the park, and then we do have the local people that live inside the Navajo reservation that also visit Monument Valley Tribal Park. And we do when you're gonna drive down the 17-mile loop drive, you still have to wear your mask even though you're outdoors. And when you go down the drive, you have to fill out an permit entrance form. There's about 15 is our limit. It's just not only to the visitors, but it's also for the Navajo people that come out to visit us. So we only allow 15 vehicles. Once a vehicle comes back out, like let's say one comes out, then we send the next person, they fill out a form. And on that form, there's a requirement. They call it contract tracing, just in case there's an outbreak down in the valley. And what happens is we use that form for contracting tracing just like Mr. Nez was saying, President Nez, Dr. Jill Jim, we have to report it to her. So all of these have to be documented. Even the tour operators, they take your temperature. They also have you use your hand sanitizer at each time, whatever you touch. And even if you're over here at our patio outside, you still have to wear your mask. We do have a big old sign that says, must wear masks, and it does say it at the entry. And please, we're just required to follow these safety guidelines that we're following. So I really appreciate it. So even our employees, they're down at the feed booth, they wear their masks, they use their hand sanitizer, the same thing. And the people that are running the entrance is the same way. The park does close at 7 p.m. And we do open at 6 o'clock a.m. Starting October, we're gonna start our winter season from October to probably March. It's gonna be 8 to 5, just to let you guys know. So it's gonna slow down. That's it. Thank you.
All right. Well, thank you, Adeline. And as you can see, Adeline was saying that people have to fill out some information. It's just right there as you enter the 17-mile loop and contact tracing. You know, all these parks are taking it very seriously. So we just wanted to give you an update because we get a lot of questions from the Navajo public. It's like, so-and-so's not wearing masks. They're not following the protocol up at the park. You know, you heard it today. You know, we're doing our very best to encourage everybody. And it's a mandate here on the Navajo Nation, yes. And we want to let's keep everybody safe, bottom line. Even our visitors safe, right? Our community members down in the park safe. So we appreciate Adeline, the Monument Valley Tribal Park manager, for doing an excellent job with her staff. I know probably at times her staff is kind of scared with all the visitors coming in, but you know what? They are on the front lines and doing their very best to keep the Navajo Nation in operation too, as well, throughout this public health emergency. So I think I would assume that maybe the park visitation by Navajos have increased. And I'm hoping that it is because we're trying to tell everybody to stay home. So you can see this is one of the most beautiful places in the world. And we want you to see your own land. I mean, we can go to Moab, we can go to Grand Canyon, all these other places. Yeah, they're beautiful. But let's also experience our own Navajo Nation. Great wonders throughout the Navajo Nation. You got Monument Valley Tribal Park. You got the slot canyons there at Antelope Canyon. You got Acai. I wanted to go to Acai this weekend, but I wasn't able to do it. To go fishing, Tsaili, Wheatfields Lake, go fishing. A lot of opportunities here, and let's experience our own Navajo country, and also just take care of it. Pick up after ourselves as well. Anyway, I'll stop there. I'm going to turn the time back over to Dr. Jill Jim and the folks back in Window Rock. So take care of yourself. Master the you know, the same thing. Ebony na ikodo hatahanan hichik undeli. So God bless you. God bless our great Navajo Nation. And turn the time back over to Dr. Jill Jim, Window Rock, Arizona. Go on in.
Yes, good morning, everyone. Thank you, President Nez. Dr. Jill Jim Schedule. It's a credit, at least by hand, big events, don't in the Senate look on the song, particularly by the chain, does it say, because of the Sonella. Adona just on the ice in the shadow of our sons and do or she iso ha kanades do kwadi ni not on in hit hanana jigi kwadi the question chagi na state at the whole yenige at the on the on us ni do Osin ha otsin the stock kwadi up at the hat lian de ya sto hut up be hande to ato kwadi COVID-19 vaccine ato kwadi ha che kushi kwa ayo pahaski en no hadi ebet kiso kwadi kwadi bet kandani got as en osin kwa ayusa kwa they get minute that's all the ko AC bin not kwadi as it kwa bahalong kwa the cousin chagi na state ato Ashin Palchana Bansa de Keso, Don in Himasandon, the Chet and Lenny, Don Hinella Estado, and Hinella Estinda Dunlenishi, Aban Sade Kesa Quadi, is it Bahalonishi Quadi, Ashwa that the arts with Chadedi in a Quadi, Bayati Kiteka, is it in the Hudano, do Quan Hinat Ani the Hudano, though. So AI don't quite a not IO not a not in the static now. Dot one and the dot energy quality so quality is it so the any on the quality is it in London IO a quad a dano go a quality task heki AI is a fill they get filled a lot on it though it's been not it though and here quality the nebekia ke ayo qua the is in London do bahas angi do I use quality ahot dako quality the question sagi na stage at the hagani quality is any don ke long that is been not that the nisha the chukon hina go eight the hoda cha ado Hito ayo at the hot on your transmission level, Heleni ayo quality at the Flachido, quality or orange or quite kit in some of the areas even not at the Nisha do I use it they go haneta do I use it ya go haneta hadi ashi he quality in his chington his because they need to know don't have chinido dot on our collegiate ultra na kego quality the basi the no has habit the chinto bezet because quality the beti new go they she to hot we had the kahot edo ayo yago the needs and at the needs at Winston all hat abansis kesa although quasi and asin anin the so kedo quality Kitlano dan daso kedo Albuquerque da hos dogonan daso kinde Asian Aden da kinde kwaidin hichinton his epic asio adeno sendo are you kwaidin ne kigon da hate ada na ada na kego adeno sendo sin kwaidin do yegon kete don no tasto Ado I use ano kedo no so only if it's necessary that they need that do that she thought that she thought was that though the I think her muscle done hichi happen na ka thought quite she thought a big bad on the sendo a wanted na ken the quite nik a do quite had he kako do quite on hitching on his because I think no sendo Asian ben not the gatherings for Yenigi crashing quite the sheep and on day the during the pandemic eben not you quite take on the killed a question how one that has on go a huge call I use a has to I the at the tutto date in the do hated on in the closer do quite inviting do but the cheho do Asian do Asian do they can transmit to the other national Danish so about the Hansen clinic a contact tracing Holgenigi a is it either quite what are banana situation Asian Ka'an Yistahadnet Sedo, Ka'adi, Heda Netwadna, the funeral, the Hoganido, other birthday parties, that any but days classes, though, other acquisition the next week have been not, though, other ceremonies, that any revivals, AI is quite then hit the is in the respondency. So I see what are they got the needs and not the now biga. And so I just wanted to just briefly mention this in Navajo just to reinforce the best that I can to let people know to travel as necessary. And when you're out there traveling, make sure you're wearing your mask and taking all the precautions because not everyone is taking those precautions. Everyone seems like everything is back to normal. But here on Navajo, we take extra precautions. We still have our hand sanitizers available and wipes at stores. And I just want to let everyone know that continue to do that. And we don't know what the impact of this weekend will have. We just hope that this time has come again to just illustrate that we can make sure that our hospitals don't get overwhelmed. Our doctors keep telling us that that these are a concern in other neighboring states, and also just to understand to keep our kids and elders in mind when we're taking precautions for COVID-19. And I think these weekly sessions are always just a good reminder as well, and also just to reiterate the importance of vaccine, that it is effective. It can reduce deaths and severe hospitalizations. So encourage people to get vaccinated if they haven't get fully vaccinated as well. And so I think that it's really monitoring this every single week. I don't think we're getting worse or getting better, but we should be able to start seeing numbers go down, I hope. And that's really will be the work of us as individuals contributing to that going down. So I wanted to just briefly speak about that. And as I would always state, it is going to be a short week, but just be careful out there when you're doing your errands and going around and about doing things that are necessary. So Ahiat for your time, and to the listeners here on the President's Weekly Updates for COVID-19. I do see Captain Johnson on the line, who's with the Navajo Area IHS, and we also are joined by Dr. Perphelia Fowler. She can probably speak after Captain Johnson as well. So Captain Johnson, take it away.
Thank you, Dr. Jill Jim. Appreciate the introduction, and also thank you to President Nez for his continued leadership and just the informational opportunity here on the Facebook sessions to provide the public with information in a transparent way as to how the situation looks in terms of COVID-19 across Navajo Nation as well as other parts of the country, as well as the things that we can do to protect ourselves. Again, this is Captain Brian Johnson. I serve as the Acting Deputy Area Director with Navajo Area Indian Health Service. My office is in St. Michael's, Arizona, and work with Miss Rosalind So here on the Navajo Nation and have for many years. So appreciate the opportunity to just provide an update from the Navajo Area Indian Health Service on a Facebook session. And it should be no surprise that we can consider or continue to consider this to be a critical point in the COVID-19 pandemic. Of course, all along, we've made that statement many times, and because it is important to understand that as long as we have cases and as long as we see increases in cases, of course, there are things that we can do to help our communities and help our loved ones. We continue to work with the Navajo Nation, various programs, as well as the tribal health organizations across Navajo area, whether we're talking about Tuba City Regional Healthcare Corporation or Fort Defiance Indian Health Board or others. The federal facilities do work and continue to stay in communication as a healthcare system across Navajo Nation, which is very important for the COVID-19 pandemic. It's important that we all understand the challenges we're each facing as an organization. It's important to make sure that we're all communicating to the services being provided, and it does make for a much more effective healthcare system. We continue to track measures every day, every week, every 2 weeks. We continue to track case numbers. We continue to look at COVID-19 positivity rates in terms of the testing that's taking place across Navajo Nation. We also continue to look at hospital capacity. You know, whenever we take a look back, and we were so fortunate over time when our caseload came down, and then unfortunately during a mid-August time frame, we started seeing some increases in some of the I guess cases, and we really need to start looking at our hospital capacity again. We know that here in the Navajo Nation, we do have, you know, some limitations in terms of the number of inpatients and the number of ICUs. So it's very important that we, again, all communicate whenever we know that the hospital capacity has increased over the last month and a half or so. We continue also to talk about contact tracing capacity. And again, I just can't say enough about the folks out there who are assisting with the contact tracing as we're dealing with the current caseload that we're dealing with. And those contact tracers work day and night in terms of contacting our Navajo people and making sure that folks understand if they've been exposed or any isolation or quarantine steps that they need to take. So we really appreciate them. And then again, we continue to look at COVID-19 transmission, how the disease spreads. And it's important because we know that the Delta variant is and has been for a while now the number one variant of COVID-19 in terms of cases across the U.S., and that includes here locally. So we just want to make sure that people understand, as we talk a little bit about COVID and the Delta variant, that the Delta variant, if you've heard that particular variant is more infectious than other versions or variants of the disease, that would be accurate. It's more contagious, and so it's able to spread between people quicker than what we had seen before. And so it's important as we continue to move into the fall time of the year, and we know that with summer coming to an end over the Labor Day weekend, and then of course we'll enjoy some nice weather here on early fall. But as we also know, as we head towards winter, we'll be more indoors, and that will give more opportunity for disease transmission if we're not very attentive to the prevention tactics that we can use and we've talked about over time. You know, there have been some conversations about the Delta variant and it actually being able to what they refer to as create breakthrough infections, and what that means is that in rare occasions the Delta variant can break through a vaccine. So if you've been fully vaccinated, that can happen again in rare cases amongst vaccinated people, but that is not the majority. That is certainly continues to be rare, and but it can happen. And so we just need to make sure that as we're talking about vaccinations and continuing getting vaccinated, it remains critical that we all do what we can to get everyone we can vaccinated against COVID-19, and particularly the Delta variant. And we do that using the same vaccines that we've talked about over a long period of time. So again, when we look around and we look at the U.S. as a whole, we understand that virtually all hospitalizations and deaths associated with COVID-19 at this time continue to be among unvaccinated individuals or unvaccinated groups of individuals. And so it's very, again, we can't state enough how important it is to get vaccinated against COVID-19. We do hear folks talk about breakthrough infections, and again, those are rare, and the overall majority of the hospitalizations and deaths at this time is among unvaccinated groups. We've talked about over time how the vaccinations are the best tool that we have to fight this particular disease, and that continues to remain the same. So whenever you may ask yourself, what's the most important thing that I can do to protect either myself or my friends or my loved ones? It continues to be getting vaccinated. That is the top priority thing that you can do to really protect those around you, including yourself. We continue to do COVID-19 testing, and so nothing has changed in that realm. If you feel like that maybe you're demonstrating some or displaying some symptoms that are consistent with COVID-19, the testing continues to be available, whether we're talking about tribal health organization facility, healthcare facilities, or the Indian Health Service facilities. It doesn't matter. COVID-19 testing continues to be available, and if you prefer to call ahead, you can do that. And there's also some schedules that continue to be displayed of testing days and times as well. So continue to, we just encourage you to continue reaching out. If you feel like you've been exposed and to a person that was positive for COVID-19, certainly we can continue to assist you with that testing, so please don't hesitate. So one of the things that I also just wanted to encourage folks on listening into the Facebook session is we've continued to hear, of course, health misinformation that has been an issue over time. And it's information that's sometimes people say without having research or science backing their comments. But this has been a serious issue in the United States over time with the COVID-19 pandemic. So I do continue to encourage, the general public to make sure that if you're listening to folks about the vaccinations, COVID-19 vaccinations, should I get one, should I not? Please be sure you're listening to credible either organizations or individuals, not just listening to social media or other venues of information, because it can be very misleading, and that has led to much avoidable illness and death in the United States. So we just, again, recommend look for those organizations who have, who are known for quality health care, quality public health advice. Certainly look for scientific resources, not individuals or groups who may use information in an inappropriate way or make suggestions that are not in alignment with studies and science that have taken place to date. So we really need to make sure that we're directing our attention to those credible sources of information. I think whenever we look around and we see where we're at presently in this pandemic, I think one thing we can say is that I believe, as Dr. Jim hit on a few minutes ago, is the cases have to some extent remained stable. Since about mid-August, we started seeing some increases in cases, and since that time, the cases have fluctuated, some up, sometimes down, but have stayed fairly consistent over the last, month or so. And so it's important to understand that we are seeing cases in our communities. So it is important that you continue to do the things that we've talked about over time. We know that we're monitoring the various variants of COVID-19, and particularly, Delta, I mentioned earlier, that has become the primary variant at this point in time in the United States. This was also seen in other countries as well over time. But we also continue to monitor variants of concern and variants of interest continually, and that assistance is being provided with the Navajo Nation, and that information is gathered and shared as well. So we do have monitoring going on with the various variants as well. But it's important that we continue wearing our mask on the Navajo Nation. Again, earlier I mentioned that we're transitioning into the fall time of year, and we'll be indoors more. And so this becomes very, very important. We know that with school-age children, that they'll be wearing their masks in the classroom settings, and have been wearing their masks, and no different for us adults as well, to make sure that we're being responsible in that fashion. Also, we talked about over time, washing our hands and continuing with some of the basic hygiene things that we can do to make sure that we're preventing disease transmission. And this becomes very important because, of course, we're entering also into the flu season as well. And so it's important that we know that some of the prevention tactics that we take with COVID-19 also work against the flu, which is also an important public health issue as well. So not only will masks and hand washing help with COVID-19, but also with the flu bug as well for this time of year. Again, I just want to recommend that folks, if you feel like that you're displaying any symptoms of COVID-19, continue to get tested. Don't hesitate. Come to our facilities. We'll take care of you and get those test results back to you as quickly as possible. And we've also continued to get plenty of vaccine. We're monitoring this closely, and we'll be continuing to make those orders and to receive the vaccine. We don't see any reason that we would ever have a shortage at this point in time. We just continue to work with our headquarters in terms of keeping that the vaccines flowing and available to the public. As I come towards the end, I do think it's important to note that we have seen locally, it's been mentioned, I think it's worth restating again, that over time we've seen that gatherings, whether we're talking about funerals or large family gatherings or other, it could be faith-based events and others, these are the types of events that can result in disease transmission of COVID-19 to a number of individuals, and this is where our contact tracers kick in. And so it's important to really understand that the more that more folks that you're around, the more folks you interact with, the higher the likelihood of COVID-19 transmission. So please take those steps that we've talked about, and make sure that to understand that again, as we fight through the Delta variant, that again is very contagious to us. That we're taking these measures and taking them seriously to protect ourselves. So not too many things new. We just need to continue focusing on what we've been doing all along. And we just appreciate the Navajo community really stepping up and helping us along the way with getting vaccinated. We urge you to continue working with your families and friends to get those vaccinations taken care of. So thank you all for the time this afternoon or this morning. And I'm going to turn the time over to Dr. Perphelia Fowler so that she can provide some comments. Thank you, and take it away, Dr. Fowler.
Thank you, Captain Brian Johnson. Always appreciate your words and your teachings, and thank you for providing the best services that we have within our nation to our people. Appreciate you and your staff, and if you can thank the epidemiology team as well. Yat eshik edo shidne kodo e yani de shid eji. My desh gizin shlon to the chini bashes chin aro kapahada shichedo tash edishinale. Kotis ahol yena adi eyes nasha. Aro kwaad tagahot Sunday e nashnish. Kodi e kodo a kwijakon na kitamona atlehon na ein hicheda huita. Ya de la huintashin a e ba na da hajit net no nishin de. Jo konde kodo ni hil ilchan adzanigi e ba nitzen. Don ni hil khaz ani ni hil okot e don hil tantni e do ba nitzen dante. Jo kodo na antini e kodo Lihinat anin lini do nihe ezeil in dan lini I see yan dan ho kanshik edo shitne di atinal ni de kosansanas et adapedi ninigi ado eze bahazligi do naha adal net dan hit no kodo ban dan hini ka ado hashine la e kodo tlan hit up ikena da hastit adat tlan dezde da do disjinje ko edo yego kata inos nishik edo shidne ashi ini o khashine la e kodon hijeta stelnde nasko e ne yat eho nihina de yel khato le ta akhiliado ta akhunitsen dole jo e yisako na ntien lini kon hiche hundel in ado anhi na khnas lashik edo shidne kodo a bini kahit a kodo be hiche khadetse a kuiche do kuche na huilisha a do na handal na shini hito hehe ha shino la lanje de no nish a do tsla do decent de jai konte sesata a do is the il no net dal na shito hehe o shi yu hehe bish don net la nante jodina ni hi e do ba he ni zenda Halan hit the nebelash la in linico ni slap ni hit up ike da hastin. Ako yego na ilnado a jane ilna. Ado n taha kesido ni hit dikizo na il in. Ako ata ahosia di no kodobe hanetse. Eshe ha I arti ne ata ahaya. Halet a arten ne shin tatan danzen. Jo echat season lini e ba aho jiliado le. Hago shin touch the raho top be ta ahujilia. A bini ye holnod e hosto gat. Ado to alchine e bini aho wade na has ta jili. Ado la alchine dan lini e to ta altra. E ultra bel nas. Ago jo ajito benat ani da holno ba altra ata. Ajiba da ultra. E shi ilto a altrone bel ka alchine lini bel ishta atosana. Ya at e. Aro honga de nahata ho da jope bit hatse na ho na gon chito bze am tates ba shi yaje awe holye dinas ni atinas ni to tsi eda konde ze bahazli at konde na chini yaje dan lini tata to ya ga beta khe ato ze bahalle ta jo e atin dal kha khoshten hol shi ilto jo e shi ilto kodo to de zen lini ba adel tkin lo zen lini ba hato le ne aro na hun e kodo di ni he ze in aji ya yanda o ka di zel ion yanda ha kai ze a ba hata ne unvaccinated ne jo e do ajin al kahi do bit hundal in o you atina al ka akodi ni Labor Day weekend da azli o shi you sa asyo kaido hita o ya do ocean yugo hita ilte konde jo beta hojilia e a eta hachito haze betado de spalo da ado di kon ze to cho to atechni da no a za ta ye ta had na i jo e belakana ke jo e misinformation dishne hashine lan hit ne asad lini do ya te ho do ya hizto ho ye yatke Edo na hapa aho nosen ado ota ahito nene joha jo edo biga ta hota ni e zeil ina aj etisi da ani e aj belbahosen ako ota ata hosyanan hidi ni lole ni chido ni ze betata des balon dakhe ni hilla da a khantan da kis tos zilbe ado thala washta ado di no da hona atais khan des es an na chiko ota hinosen ado Slango e ashkonda ado ya slango da ke ado koshident na de as aj na holji ho de dot na nish o hayu na hi chain hi masane ni human hi jen hi nalen hi tan hi ne sani da ho ban da na tra ho wanda bakhade bik eta altki ja yan kodo na de dot aso tashi kedo shidne ko wan so go she kodo so na de liado le kodo e ta ahwaliado ta hanotsen ada akuichen kodo be yelti yon hini nini bin na chun hidi nishik edo shidne ko ye go be ta ahwaliado ben hizad lini do ba ahwalia ko ado hidinosen yo ta hino nishik edo shidne kon tsago e kodo hanada si